The basic reason why I do everything that I do is because the feeling that I get when I make a difference in somebody else's life, when I change somebody else's life for the better, that feeling is something that is unmeasurable and is something that keeps me going. And when you're working in a system where you can make such impact on others, it won't feel like work, and that's why you do as much as you can. Practicing in the healthcare system with cancer patients every day gives me the opportunity to be grateful for what I have, gives me the opportunity to give perspective on life, and it keeps me going that I'm able to make a huge impact in somebody else's life.
For me, the human touch is treating patients as family, as people that I might know well, and in fact we kind of all are. We know we're all just one step away from that CAT scan that gives us the bad news, and so I guess I treat people how I would want to be treated. I had an experience early on in my career where I had a young cancer patient in her mid-30s dying of colorectal cancer. And I remember kind of making a conscious decision of stepping in rather than stepping back from the patient and letting that patient into me. And thinking, after that, I went to the nursing station. I actually cried after I had the conversation with her, but I just felt so much richer. And I thought, that's how I want to live my life as an oncologist, is involved and not stepped back. And so by treating these patients, I get richer every time I involve myself with the patient and I let them get involved with me.
About 5 years ago, I was diagnosed with a very rare cancer called chordoma. It affects the skull or the spinal cord, in my case the skull. And there's really no known cure. At best we have surgery and perhaps radiation that affects it. And after having amazing care from the top professionals in the country, who are compassionate and eager and willing to go the extra yard, I figured I wanted to give back into the medical profession, which I'm not attached to in any way other than that. And so I started thinking of ways to do that. I've been really lucky in my life. I have a wonderful family. I've had a great career, 30 years as a practicing lawyer. I've been blessed with lots of great friends and colleagues, and throughout my whole life it's been something that I've been very passionate about. I want to give back. I want to be able to make a difference in life, and it's just been the way of my being. I enjoy doing it. It's fun, and the more you give, the more time you spend, the more energy you put into it, the better you feel.
For me to interact with patients is usually a very rare thing. I'm stuck in the back experimenting and trying to figure out new ways to do things that are better for patients. So whenever I meet a patient, I talk about it for months, much to the annoyance of everybody around me. But the cool part of this is that I'm fortunate to work with a team that give me problems that are real and that are substantial problems that have immediate results in terms of improving the care of patients. So that feeling of working on something that's important and that can affect change and change something for one person, if not many, is really special and something that you never want to lose.
So I was diagnosed with breast cancer about a year and a half ago. And so I spent a considerable amount of time in the cancer center there. And I can tell you something. No one in that center ever has a bad day. It's remarkable. The kind of energy and enthusiasm and positivity that I was met with every time I was there, even through chemo, it was unbelievable. So, and when you're met with that kind of energy and positivity, you can do nothing but reciprocate. It's not the practical aspect of volunteering, it's the softer side of volunteering. It's that you see you've made a difference. Someone came with maybe a grin, and by the time, 5 minutes later after some kind of an interaction, that grin has turned into a smile or possibly a laugh. That's just an example of making a difference. So if you're thinking about volunteering, try it. I can tell you it will enrich and uplift your life in ways that, unfortunately I'm not even able to articulate.
It's the reason why I wanted to become a nurse. I think I take away more from my job than the people who receive care from me get. And it just makes it a joy to go to work and to be able to help somebody in any way. But to do it in a job that you love, and to be able to impact somebody positively, and then to imagine what it's like to be in their shoes. And as long as you keep that in mind every day, that there's an individual with family, maybe an individual without family, but there's an individual who needs help. They may or may not be able to ask for it, but we have a set of skills that can actually enhance the bad day they're going through, the devastating diagnosis they have, and the life-changing treatments that they have to receive. Any little thing we can do to make that better, that's what we want to do as a healthcare team.
Because I do what I love, being able to give is very rewarding for me, and it almost like feeds me. So I feel like giving to the patient helps, and it also gives to me. And even though it's a kind of a subtle gift, I don't think the patients realize that they're giving back to you, but I feel like the patients are giving back to me. I work with a great team, the team which encompasses nephrology, but also to support staff like interventional radiology and vascular surgeons and the nurses, and everyone is so supportive. And in the center of that team, of course, is the patients, and the patients are so grateful for the care that we provide, and that's just not me, but as a team that we all provide, and that is just the best reward that one can have, certainly in this profession.